Measuring illness and disease is tough. There are many reasons for this. First, health and disease are not always clear-cut. People can feel unwell without having a disease, and some people with diseases may not feel sick at all. This makes it hard to draw a clear line between health and disease. Another challenge is the wide range of illnesses and their impacts. Some diseases cause mild symptoms. Others can be life-threatening. This variety makes it hard to measure illness in a consistent way. Researchers need reliable methods to compare different health conditions. Finally, the impact of illness goes beyond physical symptoms. It can affect mental health, quality of life, and ability to work. These factors all need to be considered when measuring health outcomes. This complexity requires sophisticated tools and measures. One way to measure illness is through proxy measures. These are indirect ways to assess health. A common proxy measure is the number of workdays lost due to sickness. This measure is simple. It looks at how often people miss work because they are sick. Workdays lost can give a rough idea of the impact of illness. If many people miss work, it suggests a high burden of disease. This measure is easy to collect and understand. Employers can track sick leave, and researchers can analyze this data. However, workdays lost have limitations. Not all illnesses cause people to miss work. Some people may work despite being sick. Others may be unemployed or retired. These factors can skew the data. Despite these issues, proxy measures like workdays lost are useful. Health outcome measures have evolved over time. In the past, mortality rates were a primary focus. Researchers tracked how many people died from various diseases. This provided important information about public health, but it did not capture the full picture. Over time, the focus shifted to morbidity. Morbidity measures look at illness and disability, not just death. This change recognized that living with a disease can be as impactful as dying from it. Researchers developed new tools to measure morbidity. One early measure was the Disability-Adjusted Life Year, DALY. Introduced in the 1990s, DALYs combined mortality and morbidity. This innovation allowed researchers to assess the overall burden of disease. Other measures like Quality-Adjusted Life Years, QALYs, followed. These measures continue to evolve, providing more nuanced insights into health. Section 4. Understanding DALYs, YHLLs, and QALYs. Disability-Adjusted Life Years, or DALYs, are a key measure of health outcomes. A DALY combines years of life lost due to premature death and years lived with disability. One DALY equals one lost year of healthy life. Researchers use DALYs to compare the burden of different diseases. Years of healthy life lost, or YHLLs, is another measure. It focuses on the years a person could have lived in good health. YHLLs consider both premature death and reduced quality of life due to illness. This measure highlights the gap between current and optimal health. Quality-Adjusted Life Years, or QALYs, are similar but focus on quality of life. A QALY combines life expectancy with quality of life. One QALY equals 1 year of life in perfect health. QALYs are often used in healthcare decision-making. They help assess the value of medical treatments. Section 5. Comparing DALYs, YHLLs, and QALYs. DALYs, YHLLs, and QALYs each have strengths and weaknesses. DALYs are comprehensive. They capture both mortality and morbidity. This makes them useful for public health research. But DALYs can be complex to calculate. They require detailed data on disease burden. YHLLs are simpler but still meaningful. They highlight the gap between actual and ideal health. YHLLs are easier to understand and communicate. However, they may not capture the full impact of all health conditions. Some diseases may cause significant suffering without reducing life expectancy. QALYs focus on quality of life. This makes them valuable for evaluating treatments. Healthcare providers use QALYs to allocate resources, but QALYs can be subjective. Assessing quality of life involves personal judgments. This can introduce bias into the measure. Section 6. Conclusion: Significance of health outcome measures. Health outcome measures are essential tools. They help researchers and policymakers understand the burden of disease. DALYs, YHLLs, and QALYs offer different perspectives on health. Each measure has its unique strengths and applications. Using these measures, we can compare different health conditions. This allows for better resource allocation. Healthcare providers can target interventions where they are needed most. Policymakers can design effective public health strategies. In conclusion, measuring illness and disease is complex but crucial. DALYs, YHLLs, and QALYs provide valuable insights. They help us understand the impact of illness in a more nuanced way. By using these measures, we can improve health outcomes and enhance quality of life.